So it always takes us longer when we do the public ones. They come in the door, and Lynette starts checking them in, filling out their forms, and figuring out, asking the people what they want done other than the neutering. And then I take them and weigh them and give them their, we give each one of them a Capstar and a wormer and a soreness med that lasts 24 hours. Weigh them, get everything up to date on their papers, put them back in their carriers, and then take them in the back section. And then after all those check-ins are done, then we help with the physicals, and we get each one out for Dr. Darcy, and she checks each one over, and then we give the pre-sedative at that time, and then they go back in their carriers. We always do all the boys first, followed by, if we have public girls, they go next, and then FFRC kiddies, and then if we have no public girls, then we start with our smallest ones and go up to the bigger ones, and that's how we do it. So we did 1, 2, 3, 4, 5, 6, 7, 8. We took in 9 public males, but one of them we canceled. There was one that just was really thin and had an upper respiratory and just didn't feel right, healthy enough. So we gave it an antibiotic and sent it home with some wormer and flea prevention, and also for the other cat at home, flea prevention and wormer. And they're going to call us back in like 3 weeks and work on getting the kitty a little healthier. So we ended up only doing 8 public cats. And then in between all this, we had some of our volunteers bring their cats in for different things. A physical for each of them. I think we did 5 of those, and the treatment that was needed for each of those. And then for our FFRC cats, we did Fenella. That's our domestic long-haired tortie. And I will have a birthday for her tomorrow. And then Nairobi came back. Nairobi, our little orange and white kitty, when he was adopted, I noticed again the tip of that tail wasn't quite right, and it actually, as I was looking at it, that little tip came off. So I asked her to bring him back today, although we've kept in touch, and she said the bone there was still showing, and we don't want that. So I said, we'll plan on him having surgery today. But when she brought him back, the skin had finally grown over that. It was just a tiny little vertebrae. So we did not do surgery on him, and she'll be coming any minute to get him. The Persian, Mally, was here. I showed him. That was fun. I was glad we got to showed her. We gave her a really good brushing out, and she needed her nose done. She had one of those nose, when she inhaled, the nose collapsed here or tightened together, and she was really struggling to get air. Hanging out with her head back, trying to get air. Hard to eat because when she bends over, she can't eat. It just closes up. So Dr. Darcy did her magic nostril change, and she's gonna call me in 3-4 days and let me know how she's feeling, and then we will re-see her again in 3, 4, 5 months as she's growing, to see if another one needs to be done with her growth. So it was really nice to see Mally. And then we spayed Esta, the flame point. She weighed 706. We spayed Whitney. She was 6 pounds. We spayed Bambi, who's our little baby. She weighed 310. And we spayed Fenella, which was 605. So that leaves us with Annetta, and we did not spay her. I do not think she's spayed. She's just got some real respiratory issues going on, and it just was not worth putting her under anesthetic. Not only does she need a spay yet, oh, I forgot the dryer, I'm sorry. Not only does she need the spay yet, but she also needs her left eye, I think it is, and her right eye is really scarred up too. I think she might see a little bit out of there. I think she sees a little bit. I'm not positive on that. So we're working on her. We did some things today with her, and hopefully by the time we do this again, it'll be the March 24th. It will be the next FFRC surgery. So she should be ready and much healthier by then. And if we don't have a lot of newcomers, we'll open it up to the public again. Oh, and then we did a few physicals here. I'm always worried about Marilyn. Her tummy is just big. And she checked her last month for me and said she just thought it was chunkiness. And who's doing what over there? Somebody's grumping. So she checked her again today, did all kinds of little things on that belly, and she still says that it's just chunkiness. I'm being very polite. And her heart murmur, I've been listening to it, and I was really worried that it had increased, but she still says it's the same as what it was last month, so that's good. She examined Cutie. Cutie was due for her yearly. We do them actually more like every 9 months, and hers was good, was very good. She's gained a little weight. Wendy, I'm gonna have her check her over just because she's here, and we haven't, and also in case she needs medicine. Farrah, don't play with the phone. That way Dr. Darcy legally can dispense medicine since she will have seen her. But she said Wendy looks good considering what she's been through. She looks really good, and she's on a really good mo right now here. We've got her out of her pen. She's out. She's right over there sleeping, and she's much more interested in things going around her. She's very sweet, and she's going to be a good kitty adoption sometime. Scotia had a physical. Everybody thinks he's cuter than cute, and he just did real good. There was nothing wrong there. Jones. Jones, I don't know if you all know or not. Jones had several episodes yesterday of some really odd neurological things. Remember when he first came, he had a few times that some real accelerated neuro things. Well, he hasn't done the extent of that until yesterday. You know, nobody seems to really know. We don't know. There's no really word or diagnosis to put on him other than it is neuro. But what he did yesterday certainly looked like seizures, and Dr. Darcy agreed with that. We're gonna do something. We're gonna put him on a medicine, not phenobarb, but on a medicine that will maybe be just 3 times a week, and we'll see how that works for him. Can you ask her to wait for me a minute? That's Nairobi's mama. So that's Jones. Hensley, you know, he has lost some weight since he's had his dental, and I don't like it. I want all our kitties to maintain, or, sorry, she says, you have to always look at my ear. I like them to maintain if they're adults, or not get too heavy, but don't ooze any. So Hensley has lost some since his surgery, and I have looked in that mouth of his numerous times and have not. I've checked his gums, his remaining teeth, the back of his throat, under his tongue. Can't figure out, you know, he's always doing that. You know, have you seen him doing that? He's always kind of playing with his tongue and his lips. Well, Dr. Darcy said she's rarely seen this, but she said what she thinks is happening, and she saw it twice, and I saw it now that she brought it up. His his lip gets stuck on these upper canines because he doesn't have the bottom canines to keep the lip out. So it's kind of going in, and they get stuck on those upper canines. And that's when he's doing that funny, weird mouth thing that he does. He's trying to get his lip off of that. And right there where the canines are, like right in here on him, there's little bumps there, so you can tell it's being irritated. So Monday I'll probably call and get those other 2 canines pulled, and then he will be a happy camper. He's so obsessed with that, it must bother him. So we're going to get those taken care of, and hopefully Hensley will be back to being Hensley. And so we had 2 adoptions today. Yeah, there you go. The first one was Gavin. Oh, that was really awfully exciting for me, but I will miss him. He's been here for 14 months, and he's just a great cat. I know in some ways it seems...
I would have guessed it was longer.
Yeah, some ways it seems longer. So he's been here 14 months, and this 2 young ladies that adopted him, and the little girl, their little 3-year-old girl, says he's going to be her best friend. She was really good with the kitties, wasn't she?
Yes, and was so excited.
She was so excited, so loves the kitties, and they have done their homework. Oh yeah, he's good enough weight, very good enough weight for surgery. I know, she was so sweet, wasn't she, Mudgy? So, they took them home. They're still driving. They should be home in a couple maybe hours yet. So, I'm really happy for Hensley. He was kind of showing off for him, and they were so very attentive to everything we discussed about CH, and particularly about Hensley. And then we also had our second adoption was Brielle, and she went with somebody who's I've known for a long, long time. So they took Brielle. Now tomorrow, oh boy, I want to say, part of me wants to say noon, and the other part of me says that's not right. But tomorrow, Torgo and Bambi will be going home together, and this family is really a neat family. And then I was expecting the 2 mama Persians to go home tomorrow, but they contacted me today. They had some bad weather. Let me remember what she said. They're still coming. We got a little delayed in Pennsylvania this morning, so our ETA is 8:30 tonight, and it's snowing. She says, if we stop by tonight, I know you'll be in bed, but our visitors allowed. And I told her, sure. And that is good weather here, and how long are you staying? And she said they'll be staying till Monday morning. Can we do the adoption then? And she said, I said yes, and she said, can't wait to get there. So tonight, 8:30-ish or so, Paula will, oh, wait, those are my all right, I really need that record there, Farrah. Farrah struck again. So if you're on tonight, 8:30-ish, you may see her. So she's going to love the 2 girls. They're wonderful kitty cats. All right, so I'm going to go check Nairobi out, and then go check on my mama. Everything went good. It was kind of a hectic, no, it wasn't kind of, it was a hectic day. But everything's just fine. That's how I like it. Yeah. Yeah, she's really nice. I'm very, very thankful that she was willing to be patient enough to wait to see if we could get the 2 girls to be friends again, and they obviously are. One of my most fun things that I love to see and Suku and Julianne do is when they start, and they both do it, start in the cabana and just race all the way through here. It's like, you know, they spent so long in cages that it's fun to do that racing. They'll full out run. I love it. You're very, very welcome, all of you. Thank you. All right, we'll go get Nairobi ready to go home. Boy, boy, that boy, Nairobi, he's turned into a mush, I think.
Oh.